Morning, everyone. Thank you so much for being here. Just going to give people a couple seconds to get into the Zoom room.
I'm gonna take a picture of us.
And whenever you guys want to get ready, geez, get going, we can do that.
Okay. All right. Let me get out of here. Hi, everybody. Welcome back. If you've been here before, welcome if you haven't. So we're doing this. So we do caregiver series, as it says there. Caregiving is an enormous subject, so we revisit it from as many angles as we can think of. Today is a couple points to make. Today's a little different in that, for one, I'm joined by Deb Vail, who is a dear person to me, and we can say this, right? Deb, you and I get to work together.
Yeah, absolutely.
You are a client and I am a counselor or something like that, but never those are words for outside. We are two human beings who have been finding our way together for a long time now. And guys, the audience, Deb is many things: a mom of four, wife, herbalist, lives in what I imagine to be a gorgeous place in the Carolinas. And I think of your maple tree very often, Deb. Anyway, and so Deb is many things, and is, but including very special to us at Mettle. And she's also a woman living with breast cancer and Lyme disease, recurrent breast cancer. So having her own course dealing with illness, and so therefore might be cast as the patient. But as we're going to talk about today, guys, here, these distinctions become a little bit meaningless. Deb is as much a caregiver as a receiver. And so we will dig into that dynamic here today. For those of you guys who've been to the caregiving series in the past, we've level set with some slides that were pretty rudimentary and focused on some of the mechanics, the activities of daily living, the sort of mechanics of caregiving, the physical aspects of it. Today, we're not going to go over any of that stuff. We'll do that some more another time. So one more note before we jump in, guys, or two more notes. One is to reminder that there are no rules here except for be basically respectful and kind. All thoughts and feelings are welcome. Deb and I will go through just a handful of slides to kind of warm us all up and get us in the ballpark together. But then the fun part is the Q&A with you guys and discussion with you in the audience. So let me cut over to you, Sonia, about the mechanics of questions.
Yeah. Hi, everyone. Thanks for being here. So like BJ said, he and Deb are going to go through some slides. And then after that is when we go to you for your questions, comments, anything you want to say. And you can do that in two ways. You can click the raise hand button and we will unmute you and you can speak with BJ or Deb. And you can also type it into the Q&A and I will read it aloud for you. And just another quick note, yes, this discussion is a little bit different as far as caregiver series goes, but if you have any questions around things like activities of daily living or the other things that we usually cover, please feel free to ask them and we will address them in the same way we usually would. Thanks again for being here.
Thanks, Sones. And a reminder, you guys, Sones does many things, including finds the images for the slides we're going to go through today. So they're always so beautiful. And it's important that you guys know who's doing it. Okay, Deb, here we go, my friend. So, being sick, dealing with illness, cats can really becoming a patient, becoming a caregiver. These are roles, and they come with some in-box and out of the box stuff. and once the dynamics of once we're all left to deal with something like serious illness or cancer, um, it affects, it's a thorough impact and affects our relationships, and our roles can shift and those affect our relationships. And one thing to just get out of the chutes here is this is a dynamic, the caregiver and the care receiver. This is a relationship between people. Yes, we can talk about the roles, but the action is between the parties. And as with life, one of the point here is that illness is not a detour from life. It's just a piece of life. It's part of the deal. And navigating it and navigating healthcare can really put stresses on the dynamics between people. So anyway, there was a clunky setup there, but Deb, would anything leap to mind with you when we sort of talk about thinking about your own course, whether you're on the caregiving or receiving end? Anything to jump into here about how you've moved with those dynamics as they've moved?
Yeah, I'd be happy to share some personally. I mean, when you talk about relationships and focus on relationships with people, it also is relationships with all of life. I mean, when
Mhm.
my husband and I owned a farm, and so when I was diagnosed with Lyme disease and we weren't able to continue farming, it meant selling the farm, relocating, all of that. So our relationship
Mhm.
with the world and a whole new community, and the children at that point were just leaving the house when we sold the farm, so they were at home and in high school. So for them,
Mhm.
there was this tremendous change in that I was no longer able to do what I could before physically because of my physical limits, and dealing with my own health and learning how to navigate Lyme disease. And
Mhm.
they were also changing, where we lived. None of them have lived here in the house where we ended up in the mountains. So,
Mm.
huge changes on multiple levels for everybody involved, and change in what we were doing for a living. We changed from being, you know, having an organic farm to morphing in
Mm.
and doing training so that we could do herbalism. So the
Mm.
I mean, it's like you say, I think the word dynamic is the key there.
Mm.
Everything
Mm.
spills out into everything else. And just like one pivot point of me not being able to physically work 80 hours on the farm set off this whole domino effect
Mm.
with everybody else around.
Mm.
And me moving from being kind of the mother that was, taking kids to school and back and forth, and then not being able to necessarily even be able to do those kinds of things, was a huge
Mm.
adjustment for my kids and for my
Mm.
husband to really pick up the slack in terms of responsibilities that I couldn't do, and also support me. So
Mm.
yeah, and that's just Lyme disease. I'm not even talking about breast cancer. So yeah.
Right. Right
So
on.
yeah.
And that, as you're describing that history, Deb, has it ever felt like these diagnoses were, I mean, they changed your plans,
Oh, totally.
but
Yeah.
did you and Harry already have a sort of a world view that life was going to change one way or another, whether through the force of illness or anything else? Or how, did this take a while to really accommodate?
Yeah. I mean, we had actually built the house on the farm thinking that we
Oof.
would age in place. We designed the whole house so it was one story and wide doors and
Mm.
the whole thing in mind, thinking that we would be there and that eventually we would not be able to, farm in the way that we were, with having a 150-person CSA. We never expected that, but we did.
Mm.
We were expecting to stay in that area and live out the rest
Mm.
of our lives there. But we were,
Mhm.
yeah, I mean, both of us are very aware of, and I've had the honor of being with many people when they died, so we're very aware of
Mm.
illness and suffering, and
Hmm.
and death and dying, and I think, Wendell Berry is like one of my favorite
Mm.
people and authors, and so much of his work is just based on those realities of grounding in earth and aging, and the
Mm.
natural courses of living. I mean, I think one of the things that helped me through all of this was just my relationship of being on the farm and really seeing
Mm.
cycles and seasons and plants dying and becoming compost, and all
Mm.
of that. I mean, yeah.
Mm.
So
Right on. So you had the good sense of never leaving nature's cycles. So maybe it wasn't such a rude awakening to realize that you were part of a natural cycle.
no, no, not at
Yeah.
all. Not at
Yeah.
all. Yeah. So
Well, you're also mentioning something I love so much, Deb, which is, yeah, we humans get so much of the attention, but you mentioned right out of the chute something here about your relationships with the world,
right.
inanimate objects, other animals, plant life, herbs,
Yeah.
the whole shooting match.
Yeah.
Yeah.
Yeah. My closest friends that live down the road, that if I still lived there, would be the people that would be helping me now. And yeah, so I mean, it's
Mhm.
just everything. I mean, like I say, I think we just spill out a whole lot more than what we believe that we do, or we tend to think
Mm.
of ourselves as just being this body, um, and this self, but we are so much bigger than all of that. So
Yeah. Well, that's such a sweet note for this, you know, because what you're pointing to is sort of ecology, that interconnectedness. And yes, we spill out because we're so connected in ways we can see and can't see. And
right.
so, yes, you change something here, a diagnosis, a dynamic shifts here, and everything shifts subtly and otherwise.
Yeah.
I think that's such a huge note for us all to internalize, whether we're on the caregiving or receiving side of things. Um, and to not fall into the trap of thinking everything was fine and kind of fixed. And
Right.
then I had to go get this diagnosis and it yanked me over here. And it's not, no, it's never fixed. It's never static. It's always in formation, living, dying, etc. So thank you
Right.
for that note right out of the chute, Deb.
Yeah.
Yeah.
When you're talking, I'm thinking of Bio Akumalafe, who says, "We are all
Mm,
sensuous becomings." And I
I
love
love
that.
that.
Yeah.
Yeah, that's a beautiful thing. And that includes each of us, but that includes our relationships too. So as
Right.
you and Harry, as Harry is a caregiver, you a care receiver, but again, that language doesn't do it justice.
Right.
Um, yeah. Well, on that note, maybe I'll move off of this slide. There's a lot to get to. But just to hearken bio, your quote of bio, that the relationship between you is also becoming.
Right.
A fair statement.
Exactly.
Yes.
Exactly. And like you said, with all of the earth and everything around us. So yeah. Yeah. Absolutely.
Right.
Yeah.
Well, this is one you and I have talked about, again, like some of you guys out there, we have this series. We've often focused on the mechanics, the physical things, the things you can do. And I catch myself with this one a lot, like, someone who feels kind of close to burnout, not infrequently, and there's just so much to do, and it can be overwhelming. And if you just limit the caregiving world or the caring world to things that you can do, you're just sort of limiting yourself to the frame of the body, which is a beautiful frame, enormous by itself, but
Mhm.
there's more than just our physicality going on here. And the way that care is ever transmitted is, besides, it's not simply the wiping of the chin or whatever. It's not just the mechanics. In fact, the mechanics probably are sort of the vector, the Trojan horse that brings all this loving stuff to the world of emotion, spirituality, this our interconnectedness, like we've already touched upon. So the act of caring is much bigger than whatever we can do. And I started to say, for me, that's a big note, because when someone when there's another person with another need, or I have another need, like my brain goes to, oh, how can I fix it, or what can I do about it? And sometimes there is something to do about it, but sometimes much of the healing or the health that's being transmitted is not the doing, it's the being with someone, loving them, the emotional plane. Um, so anyway, sorry, I keep going on a little bit here, but what does this bring up for you, Deb? Yeah, can you talk a little bit about what it feels like to, two caregivers might bring by the same meal at the same time or something, but one may do it in a certain way that feels very different. I don't
Right.
know, anything for you to, would you'd like to jump in on?
Yeah, I mean, I think this is huge, a huge aspect of it. And I think you
Mm,
described it beautifully in that, I think so much in our world is around doing
mm,
and accomplishment and precision and getting things right. And for my own self, like perfection. So
mm,
we can kind of get stuck in that place and believe that that's all that there is, but there's all these levels of other things going on underneath things in terms of you know like for I guess, and we're going to get to this later, so I'm kind of hesitant to go into it because I don't want to blow
mm,
the next slides, but for me personally, as someone who, as I was able to do less and even now have times, there's times when it's hard for me to even walk across the yard or anything. So
mm,
as I lose that capability from my own self-esteem, I had to really go deep to understand that I'm more than just my doing and the acts of
mm,
making brownies for Harry or having the kids up for a big meal or something like that. Like, how else am I giving back? And then having this deeper understanding of ways that I was receiving care from people
mm,
beyond just what they were doing for what they do for me too.
mm,
So it's being aware of what's going on with each other, being sensitive to those needs. I mean, like I could use the word love, but that like there's so much, I don't want to do that because it
mm,
kind of flattens it. It's like
mm,
it like kind of brings in, showing respect and compassion and being conscious of where someone else is, both for both of
mm,
us, back and
mm,
forth. And then also, being with each other in at this time of like my life is coming to an end much sooner than what we had thought. And so there's a lot of emotion and grief going on. Like I think one thing that I think I don't know that it's so obvious, but it's like I'm aware of this 24/7.
mm, mm,
My body is giving me messages constantly. I can't
mm,
forget it. So I'm in a constant place of grief for
mm,
leaving here, leaving this sensuous, beautiful world and all these people that I love. And so, to be able to also recognize that like my husband will be here alone without structure, without connection. A dear friend of mine, her husband just recently died, and I think one of the hardest places for her is not having that structure. What is her purpose now? Feeling that
mm, mm,
emptiness. So I'm aware that he's going to feel that emptiness. I'm aware that I don't know where I'm going. It's a complete mystery. So to be able
mm,
to talk about that and hold each other and cry, I
mm,
mean, uh, yeah, it's priceless. I mean, yeah,
yeah.
hug each other. I mean, there's times when I'll just tell Harry, like, this is one of those days. I'm on the edge of crying.
Mm,
You're probably going to see tears all day, and all I need is just hugs, okay? you know.
mm,
So,
mm,
I mean, yeah, those, and from my
mm,
kids, just those phone calls or text. you know, it doesn't even have to be that much, but like a really great day for me is if if I've heard from all of them in some form, even for like just one text or something, it's like
Mhm.
a great day. Yeah.
Mm.
So
Yeah, that's so beautiful. And, I think that we can, there's a couple of ways we can go right here, but, one is that, that I hear you describe that poignancy. And we could say, this damn illness, uh, you know, it's taking this thing from me and blah, 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 blah. And that's also true. And I know you and I, neither of us, no one, we don't want to be Pollyannish here. But I also pick up on what you're saying here, which is there's a gorgeousness that comes with this needing each other brings, that's not just a pain in the ass. There's something way more powerful there too. And
absolutely.
I'm not baiting you to say I'm thankful for my cancer or anything like that. If you are, say it. But I mean, I guess what I'm trying to get at here is something like we've talked about, how things going wrong or how we might not want them. Okay. And there's sorrow there. And there's other things there too. And it often plays out in these emotional and spiritual planes. And if you have a narrow view of caring and caregiving as simply a transaction, you're missing out on, all parties are missing out.
Absolutely. Absolutely. Totally. Yeah. I mean, we've been working together for a long time, so I can't just, there's so many things that you've helped me
Yeah.
with and Mettle has helped me with that it's like, I got out, like, I think I have like 12 or 15 pages of just highlights of things that
Mm.
have really, really made a difference for me. But I think one thing, there was a quote that was up one time on the Mettle page, and it was something, you said something like, embrace it all because it's all gonna go. And
Mm.
like, I've done mindfulness practices and spiritual practices my whole life. And, you know, maybe too prideful about being aware and being
Mm.
grateful or, whatever. But there was just something about the way that you said that went in this particular way of like, yeah, being grateful even for the pain. I mean,
Mhm, mhm,
being grateful for even the argument, even being
mm,
grateful for even discord. I mean, like, and that has really, really changed for me. It like
mm,
shows that I'm still here, that I'm still feeling. And so I have crescendo. That's another one of the
mm.
beautiful word from you. Like my heart has become more open. Not always, I can't always do this, sometimes more in hindsight than at the time.
Mm,
But there was just this really beautiful beautiful deepening for both me and Harry, because I talk to Harry about it all the time, like,
mm, mm,
and we're really, really aware of it. I mean, we joke with each other too. I probably shouldn't, people might think that we're being sacrilegious by some of our jokes, but
mm.
we'll tease each other and I'll say, are you gonna miss that when I'm leaving you a list of 40 things to do? I'm gonna miss that one. But acknowledging just that, the beauty of, and I go back to the word from the other slide, of relationship,
Mhm,
no matter what's happening in the relationship, whether the beauty of relationship within your own body,
mhm,
the messages of pain that show you're here,
mhm.
all of it. Yeah.
Amen, mama. Yeah. And I thank you. It's hard to talk about these things without accidentally fetishizing
Right.
suffering.
Yeah.
Oh, it's not what we're trying to do here.
Yeah.
A fuller picture, I think, is what we're trying to do here. And back to our note on, if this webinar is about caregiving, well, I think there's a couple of things to pick up from what you're saying. Is there's more than just the doing. Um,
Yeah.
and one thing to say is, in contrast to what I just said, caregiving, there's a lot to do. Being alive, there's a lot that needs. So I don't want to, the messages in here, do more. Oh,
Mhm.
besides the to-do list, the emotional, spiritual plans, like the message isn't more. The message is you have to do more. The message is you get to see more through these lenses, through these things that pry open our eyes. And so whether you're, for caregivers, let that happen, because it may be painful, but it fleshes you into new zones with new lines of sight and new feelings. And so not only you have to deal with these things, you get to deal with these things.
Right.
And one other note, also what you're saying too, is very often one of the frustrating aspects about being a caregiver is like there's some you put in front of situations that they're really, if there is something to do about it, you don't know. I mean, it can feel absurd and impossible. And like I was starting to reference earlier, can feel really burned out if there's one more thing I've got to do on the to-do list. Well,
Right.
the good news here is you don't have, that it doesn't cost you anything to feel something.
Right.
And there's an
Right.
unlimited amount of feelings to be had. You don't
Right.
have to do anything with those feelings necessarily, but
Right.
be with them. It's that simple and that hard.
Right. Right. And I mean, I would even go so far as to say that at least for me personally, I would rather have less doing and more of this being, like, the times
Mm,
when Harry or my kids just come and sit beside me. It's like, no, I don't need you to ask if I need anything. I just want you to
mm,
come and sit and hold my hand, even if it's just
mm.
for a minute or two. Look directly in my eyes. Like that's what I need. And that, so I would prefer a much bigger diet of that than
Mhm.
being a lot of doing coming towards me.
Right on. I remember when I was in the hospital, I talked about this. It feels being cared at. I just, basically my job was to sit still and take it.
Oof.
Um, so, anyway, that we'll cut to that in a moment.
Yep, yep.
All right, sweetheart, let me move us along here. Well, here again, we've been saying this, one way and another. Well, I'll just pick up on what I was just saying. I mean, I remember, and honestly, guys, this is 30 for me, 32 years into after my injuries, and I'm still coming to terms with sort of the fallout. And most recently, it has had for me personally, without getting lost here, it's had a lot to do with this feeling of debt that I owe the
Mm,
world and owe so many people for all the care that I took. Because I fell into that caring at like caregiving, receiving. I was the receiver, so I just took all this care and gave nothing. Ostensibly, I just was a suction sound around me, all the time, and took, and there's plenty I did take, but one of the things that I'm realizing, even as I've talked about it, I hadn't really done my own homework around this. I felt terrible about that basic math, and have
mm,
been kind of trying to pay off that debt in a zillion different ways for years, and spastically. And anyway, but I will say,
mhm.
finally I talked to my friends about this, and they all just kind of said, "What the hell are you talking about? Like, we gained so much from doing this with you, moving through this. We learned so much." And
Mhm.
and hearing that from them recently, and then hearing it also from my nurses early on. I remember being in the hospital and this caring at feeling. And anytime, I didn't quite know how to articulate back then, but anytime someone got something from the experience, I remember how much better it made me feel. It wasn't
Right.
them being selfish to dare to take something from the experience too. No, I wanted that. It was healing for me to know that I was involved in giving something while I was doing all this taking. So sorry for the ramble, but that's my own personal setup. That strike any chords in you, Mama?
Oh yeah, and my heart just goes out to you. I mean, I don't even know that I can add anything. I mean, that's so poignant and beautiful, and I'm glad that you've moved beyond feeling indebted.
Thank
Can
you.
see, yeah, and can see how much you gave back. I mean,
Mm.
I know you well enough now to know just how much, I mean, I know how much you give professionally and how many lives you've touched, but like just with me, I mean, the eye contact, the care, I mean, it gets so basic when you're there, of, these interactions that we have that are, we don't necessarily even notice them or even acknowledge
Mm.
that they're there, but all this body language
Mm.
and glances and touch and all of these other things that just get to the core of who we are as these moving bodies. And yes,
Yeah.
so we're all
Yeah.
wanting that kind of reception and interaction and relationship all the time. So
Mm.
even when you were after your accident, or as I become bedbound, I want to be able to remember that,
Mm.
just as people touch my skin, it will be a gift. I have this is no surprise to anyone who knows me very, very well, but I love to have my back touched lightly, like tickled.
Mm.
So
Mm.
so my husband basically, like every night for like hours, he tickles my back. So, and I
Mm.
don't have the strength in my arm to touch him. He doesn't like light touching. So this has been
Mm.
like a huge thing for me, because I'm like, you're constantly touching me and giving and doing this thing that I love, like that I just mush,
Mm.
and I'm not giving back to you. And he has asserted over and over, like, he's like, it's like just my fingertips touching your skin
Mm.
is all I need.
Mm.
So
Mm.
so anyway,
Mm.
yeah.
No, sweetheart.
Yeah.
Thank you. Yeah, right. I mean, in that dynamic, who's the giver, who's the receiver? Right? With Harry's comment.
Yeah. Well, thankfully he can see it that way, because otherwise he would have been complaining.
Yeah.
So
Yeah.
yeah.
Amen. I mean, I know not some of these more vaunted planes that we're talking about. They're not always accessible, and
Yeah.
it just can be brutal grunt work too. Many things.
Yeah.
So
Yeah.
in all directions.
Yeah, absolutely. And I feel it's really important now, and you've done this a couple times to bring it back, which is, I don't want to romanticize all of this, and I also just want to acknowledge, I mean, there's whoever's watching that is a caregiver and is giving that physical care. I know how hard that physical care is to continue to give, and how you may not have enough energy. Harry fell off the roof and broke his back, and he's had open heart surgery. So I have also been the one that was giving the more physical care too. And I mean, it's hard, and I don't want it all to communicate that this is about giving more, which you already said, but I want to come back to that. So
Yeah. Thank you, Deb. Gosh, I'm tempted to ask you, I'm just looking at the clock, but
yeah,
you're also, it's a little bit of a, well, I don't know if it's tangent at all, but I was wondering if this idea of this importance of giving as part of your own care. Gosh, there's your own self-care, which has been profound, and how you've moved with that. Now you've given yourself that care, if we have to stick with the giving, receiving language.
yeah,
There's also the story of your dad, and there's a story of your grandfather, how
yeah,
both gave you something really important towards the end of their lives,
yeah,
and they were the patients.
right,
And one of those gifts took many, many years, if I remember correctly, to kind of realize, which is also sort of the beauty thing, something beautiful to mention here beyond the plane of physical doing. Another
absolutely,
reason to tap into this emotional, psychic, spiritual plane is it has a different timeline.
right,
So I don't
absolutely,
know.
yeah.
Of any of those three invitations, is there anything you'd like to talk about here?
Yeah, well, again, I could go on and on, but this should be like a whole weekend with everybody sharing, because there's so much here. But like, yeah, I mean, yeah, I mean, I just skip right to I think when you're talking about especially different generations, like my grandfather he was a real pistol. I mean, he was really out there kind of person. And I was growing up kind of always embarrassed about him. I come from a big family in a small town and a family of farmers, and he had a machine shop in town, so everybody knew him and everybody had interactions with him. And my whole life I was just kind of like, yeah, Ralph Bly's my grandfather, that kind of thing. And he never went to a doctor his whole life, or anything. And he took care of burns when he was welding, everything himself. And so at the end of his life, he was getting more and more, losing weight and declining in his 80s, and refused to go to the doctor. He just ate horseradish and honey. That was his medicine. So anyway, so when he finally ended up having to go to the hospital, of course they found that he was covered with cancer, and he just lived 2 more weeks and died in the hospital, unfortunately. My grandmother wasn't able to bring him home, but anyway, now I had lived with this like kind of embarrassment of who he was and his choices and everything, and now that I'm here, I'm choosing things that are much aligned with his choices. I'm not eating horseradish and honey, but I'm treating myself with herbs and pulling out of the medical system probably before many people would, and so that I can actually live my life at home. So I had this tremendous healing from seeing him and appreciating him and honoring his choice and looking up to him in a way that I never have. I mean, I'm almost 63 years old, and here this gift comes back in, like that. It's yeah, it is tremendous. And like to say like, oh my gosh, I didn't even realize that I was following so much in his footsteps until, just recently. Of like, wow, okay, this is humbling and beautiful and everything. And I'll tell the other story about my dad too, because I think it's just when I moved to Alaska right out of school, and at the airport, and when I left, my dad said, I brought you into this world to give you life. This is your life, go live. And so when my dad was dying, he was in the hospital, and actually the doctor, I was saying goodbye to him. My newborn infant was in my arms, my youngest child, and I had to leave. She was losing weight. I had to go back home, and we were saying our final goodbyes. And the doctor team had just come in, and they were surrounding. There were like 8 doctors. How he had enough. He had a tumor in his spine. How he was able to sit up, I don't know. But he sat up to give me a hug. And he said the same thing, like, yeah, I brought you into this world to give you life, and go live it. And it was complete freedom for me to leave and to go nurse my baby and, fly back home. And so yeah. And I both of those things have really informed me now in terms of, like, I feel like my parenting now is actually how I deal with this illness and how I die. And I take that very, very seriously. And you've helped me to take it seriously and honor that, and also not get stuck on trying to do it perfectly, BJ. So thank you for that too. Having the freedom in that, but realizing that whatever happens now, even if they don't understand, and even if they don't get it, or friends, family, whoever doesn't get it, that hopefully at some point things might make more sense, and people might I've tried to be really vocal with friends and family about what I experience and physically, and I'm hoping to have a lot of people around so that people can actually see dying and see what living with cancer looks like, and really view it. And I'm gonna have, home funeral and burial at a conservation cemetery in a shroud into the ground. So because I want people to be able to see death and dying.
And therein is a big piece of what you're giving, even as you are taking, even as you are the patient. Thank you, Deb. Well, no, not hopefully. You're doing it. It is happening.
My intent.
Well, you are living your intention, sweetheart. It's beautiful. And a gift to Harry, to me, to anyone, your kids. And a gift we'll probably be realizing well after you're gone, which is quite a statement.
Maybe.
Oh, baby. All right. Well, not to cut anything off here, but I think this is our final slide, and I think it's a point we've been making again and again here today. That so many things that death or illness or just life will eventually teach us is you can't separate all these things. Like the giver and the receiver are inseparable. It is a dynamic, and all parties are doing it all the time, whether we choose to see it or not. But anyway, before we cut to the audience here, Deb, is there anything else coming up for you around this reciprocity, around, any notes for the caregivers in the audience on this?
Well, Annie, Annie, I love Annie too at Mettle. I just called Sonia Annie. So Annie, when you listen to this, you'll hear your name. But I guess, I just want to say that like this slide and this vision, this beautiful art, I think it says everything right there. And what you said, it's what we've talked about. I feel I'm very honored to be here, and so grateful for finding Mettle and finding all of you that have helped me to embrace this time in my life and to open to it rather than to close down. And I was in a pretty big state of fear when I first started working with you, BJ. Moving beyond that fear into that place of total giving and receiving and acknowledging that. So
Oh, Deb. Well, I will just let you have that last word, because that is beautiful. And thank you, because I am receiving so much with you, from you. So thanks for daring to open up this dynamic with me and with Mettle and with all of us here. It's so kind. So thank you, Mama.
Thank you. Thank you.
Well, Stones, are you there? And what do we have going on from the audience?
I am here. If you want to close out those slides, there've been a few things that came in. Deb, also just some lovely comments for you, just appreciating your vulnerability and sending you lots of love. And thank you so much for being so open with your experience with us. Michael said, I took care of my dad and then my mom for the last 5 years, and now I'm alone in the world with no partner or kids. And the intense grief triggered some severe anxiety and panic. And I'm realizing that I have no one to care for me. It's an honor to care for someone and a blessing to be cared for, but I'm wondering how to navigate when the caregiver gets sick and has no one to care for them.
Oh, yeah, that's a big one. Oh, Michael. So yeah, for all our talk of the giving and receiving loop, it's not always so symmetrical, and it's not always so accessible. and it's not, and the care isn't right where we need it sometimes. And so I just need to, I think, Deb and I, we try to do, this is, for so many reasons, can feel really difficult. And a lot of folks who have a zillion people around them to care for them have a really hard time letting it in, or feel terrible about taking it or whatever else. So again, there's, Michael, I'm taking your comments to just make sure to broaden our emotional web here. I mean, so, and one other comment, Michael, about so how to navigate that. Well, for those of us who plan to be alone towards the end of our lives, this is where hospice is extra important. It's kind of the closest thing to a family you can kind of rent. That's the wrong word, but that's sort of what the healthcare system has to offer. But I also, your comment also makes me think of there are close-in people, our spouses or friends, family, but they're also strangers. I mean, I think a lot of us can hearken to moments where we've gotten someone has sort of saved our life. They didn't even know it. They were just walking by and had a smile or held the door open or whatever it was. So I also take this point, Michael, to remind us all of these, what seem like smaller connections, but can be so consequential with neighbors, with strangers, and then with the world beyond humans, like we've talked about. I get a lot of care from the animals I live with. So none of the things I'm saying here makes up for the idea of what you're pointing to, Michael, the idea of being alone with illness or being the caregiver, and therefore it seems like you can't afford to get sick. Well, these are all true statements, and there's a lot of this work that isn't fixable, that isn't possible. And eventually you and others around you will be left to sit with the pain that they can't fix too. That's part of the picture. But Deb, any other reflections on Michael's comment?
Yeah, I actually would like to say something, which is just that I think our society is one that has the belief that we can't ask for what we need beyond our family or our really, really close friends. Maybe not even our really close friends. And so, I want to point out my neighbors across the street who, I mean, like he's been taking care of our yard, like mowing our yard for us and stuff. But I was just talking to him the other day, and all of his kids have left and moved from the area, and grandkids. And he's like, we don't know what to do with ourselves. So we actually found this family or found this person who doesn't have anybody, and we're providing care for them at the end of their life. And they're driving 45 minutes a day, he and his wife, to take care of this person that they just barely met. And they're taking them supplies and I mean, so I encourage, all of us to grow and reach out and not live by the confines of what our society expects. So ask people and let people give. And if somebody does show up, tell them how they can help, and don't have the belief necessarily that you're asking too much of them, or, because we have all these things inside of our mind that block us from believing that we have the right to ask. And I think, at least what I see, is that people really do want to give and want to be there.
Yeah. Yeah. Thank you, Deb. Right on. I think it's also, there are structural things we should all be increasingly, to the degree we can stand it, be politically active. There's legislation around family and medical leave. There are ways to make the systems and structures can make this adventure easier or harder. And so part of the answer too, I think, is finding the activism in us to change what's changeable structurally. That goes with what you were just saying, Deb, which I take as a kind of activism of daring to ask for help in this world.
Right.
And one of the saddest things we run into is the feelings of, I know them well, of being a burden.
Right.
But that is such a made up issue. Of course, everyone's a burden. We all need things. We all need each other all the time. There's asymmetries over life. But even if we can't find that help in the moment, I think it's helpful for us to know that on some level, we're not asking for too much. And on the other level, even if there's someone who can't be there at the bedside, Michael, someone who's 1,000 miles away, this is where caring beyond the doing is also important. And registers somewhere. I believe that as well.
Yeah.
So, okay.
Can I say one more thing?
Oh,
I want to
sure.
give a
Yeah,
perfect
please, Deb.
example. I don't know how many questions there are, and I have no idea what time it is, but I just
Mhm.
remembered one of the people that I was honored to be there when he died. He was a father of one of my daughter's classmates, and he had glioblastoma, and he was a
Mm.
single parent. And um, I kind of leapt into like, we can help out with Naomi and, do whatever. And then quickly found out that like there was no way on the farm, and he lived an hour away. I mean, I couldn't do what I needed to do. And there was this, oh, I remember this one night just praying like he needs somebody, like he's got to find somebody. Well, magically, this woman showed up whose husband had died of glioblastoma like 5 years before. And she was a widow,
Mm.
and she heard about him. Well, he lived for 3 years. They ended up falling in love together. They were out dancing. They went up to the beach together. I mean, they didn't get married, but it was an
Mm.
extremely fulfilling relationship for him and for her too. And she did it knowing what was going to happen, because she had already lived through it with her first husband and everything. But it was a
Mm.
tremendous gift. And this woman is still mothering the two children, his two daughters.
Wow.
So,
Uh,
Michael, I just want to say, there's, I mean, beautiful things can happen. And I don't mean to,
mm.
I mean, I hear your pain and fear and everything, but miracles
Yeah.
happen all the time. So, yeah.
Yeah. All right. Thank you, Deb.
Yeah.
Yeah, Sonia. What
Yeah.
else?
So one of these questions came in, Deb, when you were talking about your relationship with your husband, and the comment is, can you define intimacy in this context? Has it changed? Do you also have any comments on companionable silence?
Yeah, I mean, intimacy has changed dramatically. I mean, between us. I mean, if you're talking, sexual intimacy has been a tremendous change between the two of us, because I don't have the energy to make love in the way that we used to. But we've found all these ways of communicating with our bodies, and touching each other and being sensual with each other. And in other ways. So that is definitely morphed and expanded into places that I had never really even explored before. So that's really beautiful. And yeah, companionable silence. I mean, gosh, that's the ultimate, isn't it? That's the
Mhm.
ultimate. Yeah. Yeah, eating together in silence. I mean, I often lose my voice. As the weaker I get, my voice mimics. It's kind of I don't know, almost a sign of people can tell more from my voice and how I'm doing than how I look, I think.
Mm.
So I can't many times talk, and my voice is just gone. And yeah, so much is communicated in those times. Absolutely. So I don't know if there was a question inside of that, or if I got to it, but I think it was
Mm.
beautiful to point out those things and how they grow and are part of the expansion of relationship. So,
Mm.
yeah.
Oh, I love that last phrase, because I think otherwise it feels like illness constricts the relationship. And on some level, true enough, but
Yeah.
on other levels, quite the opposite. So even as we talk about decline, our declining health, a declining body, or everything's getting smaller, the world's getting smaller, the emotional world, the psychic, psychological, spiritual world can get, the relational world can get more vast, bigger, bigger, bigger. Right on. Stones, what else? Any other comments or questions to?
Yeah, I'd love to include this comment that came in as well. This person said, you can't have these discussions caring for someone with dementia, which adds to the grief. It's death by 1,000 cuts for the loved one and the caregiver.
Mm. Yeah, no sugarcoating that. You know, so much of what Deb and I get to experience, Deb, what you and Harry and your kids get to experience, has something to do with you having the capacity to communicate and
Right.
engage,
Yeah.
which gets so difficult with dementia. So before I go on, did that spark anything in you, Deb?
Yeah, I mean, first of all, I just feel like, both Michael and this comment, like I want to make sure that I feel bad if anyone felt excluded by hearing what we were talking about, and want to make sure that, to acknowledge that, these other parts of it. And I think the comment before about sitting in silence and touch, I mean, at least the people I've been around with dementia, there are still ways to communicate. And I think that someone in dementia still is in relationship and knows that people are around them. So touch and being in silence is, even at that point, even more so important. So, yeah.
Amen. Thank you. That's that's right on. Yes, there's a lot here in terms of reflecting on what's happening, where verbal communication and executive functioning are important. But thank you for bringing it back, that we're just talking about the thing, and the thing is this connection,
Right.
and that can play out in zillions of ways, and often nonverbal. And it may look very different than it used to. The dynamic may very well be very different with the person now that they're in dementia. And I just don't want to take anything away from that question. And I think the answer still is to find these nodes of connection and these relational moments, verbal or otherwise. I think the answer is still much the same. Well, guys, we're right at the hour. Stones, were there any other questions or comments to sneak in one last one here, or shall we call it a day?
I think that's really it. There's just another lovely comment about, allowing someone to care for you is a blessing. They find the giving a blessing as well. So just kind of repeating what you guys have been saying. There's giving and receiving, and there's goodness in both of it. But yeah, I think we've gotten through everything. Deb, thank you so much for being here and sharing your experience and your thoughts.
Thank you for inviting me. It's really, really an honor to be here with such beautiful company. And again, I can't say enough gratitude for all of you that have made this journey what it is for me. So thank you. Thank you.
Deb. Oh, sweetheart, that was fun to be with you today. Thank you very much for showing up and sharing like this. Thank you, thank you, thank you.
Thank you.
Yeah.
Thank you.
Yeah. And thanks everyone for joining us. Hope everyone has a nice weekend.
All
Bye,
right.
everybody.
All right. Bye-bye.